it burst on the scene in the same way, very rapidly in 1981. So and then you're dealing with, issues of trying to teach people, trying to talk to people about how to prevent it when you don't have a complete knowledge base. We talk to people about treatment when there really is no treatment, the need for diagnosis before we really had diagnostic tests. Now, what's different with COVID is that the diagnostic tests were developed very rapidly. I don't know if you remember this, but the test for HIV was licensed on Valentine's Day, 1985. So it took 4 to 5 years to get it. So, I mean, we were right out of the box with a good diagnostic test for COVID, and that part of that's just the growth of molecular biology, and this is all the payoffs of molecular biology over the years. So those are the big things, and then you end up with people who've been infected, and there's stigma, and there's a lot of "this can never happen to me" sort of feeling that floats around both COVID and HIV. And unfortunately, we're still living with HIV today. Hopefully, we won't be living with COVID for that much longer.
And the issue of testing and tracing, that was something that was used in San Francisco to fight HIV. How has that worked out today fighting COVID? Because I know that there was an effort initially to make sure that there was testing and tracing of people who got the infection, the virus, and apparently it's not working anymore because of the vast expansion of this virus.
Oh, it actually works. It works pretty well. You just need enough people, right? It's a person power thing. And we've been keeping up with it pretty well in San Francisco. We've now introduced some of the state's new software so they can actually do electronic notifications, kind of having a technological solution on the end of it. The other thing is that people are in contact with a finite number of people because the incubation period is so short. We're only talking a period of 3 to 5 to 7 or 8 days, depending on kind of when you show up relative to your symptom onset. With HIV, it's everyone you ever had sex with in your entire life. That was the original contact tracing formula for HIV. Now it's and we didn't in San Francisco. We didn't put a lot of stock in contact tracing for HIV, at least initially, because it's so there were no kind of temporal limits around it. It's from puberty on, and so you can imagine, and finding people is just impossible. And we thought that the effort was better spent with kind of general messages around safer sex. Now, interestingly, in San Francisco, and we're actually involved with this in Africa as well, which is trying to use newer technology for HIV that differentiates old from new infection. So we're saying, okay, we know you've been infected in the last 6 months. Okay, so who are all your sexual partners in the last 6 months, and we'll get in touch with them. So that narrows this window down and makes it much more practical. Plus, we have something to offer them if they turned out to be infected. In the past, it was just tea and sympathy. I mean, in the early 80s, there really wasn't much you could do. Now we have early therapy with antiretrovirals, which make a huge big difference. And it's really changed the paradigm of HIV control.
And Dr. Fauci was actually in San Francisco in the effort to deal with HIV. You think he got some education as far as dealing with this kind of pandemic of HIV?
I think seriously back in the day, I think what he understood was that you really could have community organization around HIV prevention and make it quite successful. This was really in the very early days, and where there was a lot of attention paid to hospice care and trying to and social support and things like that. It's before the first antiretroviral trials really burst on the scene. And then he had a whole other issue, a series of issues to deal with from around access to antivirals, more rapid approval, more rapid trials, those kinds of things.
And the issue of the public health system in the United States being a problem, particularly in rural communities that don't have the kind of public health infrastructure that, for example, San Francisco has or other big cities. There is now in Central Valley 0.7% vacancy ICU units,
Yeah.
an overload, and if this virus spreads, possibly even a shutdown or collapse of our healthcare system. Are you
Mhm.
concerned about that is in this pandemic, which is maybe even getting much worse?
Yes, yes, I am. And anybody who's knows, a half a thing about this is concerned as well. We already saw it in Italy, in New York City, and in Spain, and it could very easily happen here, and it may already be happening in the Central Valley. It happened earlier this summer in Imperial County, where they were completely overwhelmed and had to basically send all their ICU patients as far afield as Davis. So it's this stuff can happen. And what we have now is the capacity for sharing beds statewide, but understand that a lot of the state disaster plans are based around earthquakes and fires. So something bad happens in Southern California, you have all of Northern California unaffected that can help them. Something bad happens in Northern California, you have all of Southern California unaffected so that they could help. But it's here it's really pretty much across the board. The Southern California, especially around kind of metropolitan Los Angeles, is just being hammered, and there's only so much that they can decompress there before they have to start sending people north. And at the end of the day, if all of us get caught up in this, we don't really have a lot of places to send patients. Oregon doesn't have that much capacity. Nevada doesn't have that much capacity. Arizona certainly doesn't. And that's where we're going to be. It's going to be tough.
And I mean, if there's no capacity in ICU, then people may die as a result of not getting treatment. And those people who have non-COVID health conditions may also be in a problem.
That's certainly the concern. I mean, we'll try and create capacity, but at the end of the day, if you don't have one-to-one nursing, if you don't have intensivists, intensive care physicians, and respiratory therapists who are dealing with single patients and their problems at a time, you're trying to deal with the whole slate of people at once. Things are going to fall through the cracks,
Now,
as happened in Italy.
this vaccine that's been developed came in a very historic, quick time. There is a concern and issue. Is it a vaccine? In other words, I understand that people can still get affected, but they won't get seriously sick or ill by it, and they may also infect other people. Do you think that this is a real vaccine that is actually stopping people from getting infected? Number one, and number two, do you think people, even if they have the vaccine, will continue to have to wear masks and other PPE, other protective equipment?
Sure. So legitimate question. So first of all, the trials didn't look. It's not that we know that it doesn't work. It's that nobody looked. Nobody looked to see if it affected the carriage of the virus. So those are studies that are now being put together to follow people who've been vaccinated prospectively and to understand if they can actually carry the virus after they've been vaccinated. I think smart money says it's unlikely, but it could happen, and we need to know the answer. So I think that what we'll see here in the next few months is whether there's a drop off as we start getting more and more people vaccinated, whether there's a drop off in cases, which would suggest that it cuts down on transmission as well. But yes, people should continue to wear masks even after they've been vaccinated. There's going to be a certain failure rate, as there is with any vaccine, of maybe 5%, maybe a little bit more, and you don't know which of that 5% you're in. So you know, somebody like me with gray hair is going to be wearing a vaccine, wearing a mask after I've been vaccinated until we really get enough people vaccinated for herd immunity.
And the issue of transmission, and particularly in workplaces, Central Valley meat plants, there have been 9 deaths at Foster Farms.
Mhm.
You have the plant Tesla, where many of the workers go back and forth between the plant in Fremont and the Central Valley. Protection of workplaces, how does that factor in the transmission of disease? And is that an issue or concern that you have as far as protecting people in this country and working people in particular?
Yeah, sure. I mean, the workplaces, especially kind of big assembly line places, have been associated with transmission. Everything from meat packing plants to an apparel company in Los Angeles, and to fruit packing plants in the Northwest. So it can happen, and it's something that OSHA and Cal OSHA are very concerned about. And basically, once you get a case in, you got to really put the screws down and get people tested exclude those who are infected and pay them to be excluded. So there's no sneaking back. There's no monetary incentive to sneak back into work prematurely. So yeah, but the plants are actually, I don't know about Tesla, but I can tell you that the meatpacking plants now have, kind of plexiglass screens up separating workstations. But, if everybody rides to work together in the same car without their masks on, there's only so much protection you can do at the, at the workplace. So it's really incumbent on people to protect themselves wherever they are, and the workplaces, they get some help from their employers, but they have to protect themselves at home too.
And are you concerned that there are only the less than 200 OSHA inspectors in California for 18 million workers? It seems to be a problematic issue since that's a small number of inspectors for such a large number of workers.
We're talking about Cal OSHA
Cal
or
OSHA,
federal
yes.
OSHA? Cal
Cal
OSHA.
OSHA.
Well, they're also, they're augmented by federal OSHA, but I assume that's a smaller number. Yeah, I mean, that's obviously a concern, but people know that this is their employers know that this is their responsibility and take it seriously. They know that there's a big stick that Cal OSHA and OSHA carry.
And last, on how other countries have dealt with the virus and trying to contain it, what are the lessons they've learned in China, South Korea, New Zealand, Taiwan, and why have they been more successful in those countries in being able to control the virus spread and also control the number of fatalities?
Sorry, I think that's just a delivery guy. So the so New Zealand's an island, or it's actually two islands and a bunch of little islands. Don't ever forget that. So they can control who comes and goes. Right? That makes a huge difference. Being able to control that, influx of populations, it really makes the kind of traditional public health things of contact tracing, test and treat, all those sorts of things much more practical. South Korea actually has done, it uses a very kind of different model than we do. They're, if you're reported as a case, the Korean FBI comes and takes your phone away from you, figures out where you've been, runs all your credit cards, and then goes and finds you on closed circuit TV and finds everybody you've been in contact with. Okay, I could see that going down in Berkeley really easily, right? So it's just not, it's not the same. We're not dealing with the same level of privacy laws or individual rights, and there's a real push towards the corporate, towards the societal level. Taiwan, I think, has also as an island and has been able to control influx and efflux quite well, and kept it down from very early on. Taiwan had a pretty good experience with regular SARS in 2002, so they had a system set up to deal with this sort of stuff. So that's all good. China, China will do stuff. They find one case and they lock down a city of 11 million people and tested every one in 3 days. So you can imagine getting everybody in Los Angeles tested in 3 days, right? That's not a happening thing in our system. And the other thing is that, if we started to do that, everybody in the line would get infected. I mean, it would be a big amplifying event. You have to have low counts in order to do that. But what China did was this so-called, in public health terms, a cordon sanitaire, a kind of belt around an area and keeping people in and out, keeping people from going in and out. And that's what they did in Wuhan. Now they had 70,000 cases at the end of the day in Wuhan. Wuhan's a city the size of Los Angeles County. And it's going to be, I could see us having, I don't know how many cases we have right now in Los Angeles, but we have a lot, probably more than that. I think we have 1.3 million in California, so it's got to be a ton in Los Angeles, 533,000, just so you know. So Wuhan is a city of 11 million people, the same size as Los Angeles County. When the Chinese lock stuff down, they lock stuff down. There's no screwing around. You have to stay home. If you go out, you have to have a hall pass. It's really, they really meant it. And they ended up with 70,000 cases. Los Angeles today has had a cumulative total of 533,000 cases. So it's not the same order. It's the stuff they do in China, the stuff they're doing now in Western Europe too, which it's a much more draconian than it has been. That's the stuff that gets you out of, that gets you out of these things on the other end. I think it's instructive to see what what France did, and France won't let you go within beyond a kilometer of your house, and you can only go out for certain essential kinds of things. Um, and it's that's it, right? You just you can only go out for the groceries, the pharmacy. It's like shops, right? The tobacco store, of course, because that's the tobaccos are specifically excluded because, interestingly, I think that's where they sell the lottery tickets, which finance the French government. But whatever, it's just sort of a different construct, right? But they have a finite number of things open, and it's it's serious. The police enforce it. You know, people are walking around here today doing God knows what. So.
And Sweden and what has happened in the other Scandinavian countries, they decided they weren't going to have a lockdown.
Yeah.
Apparently, what were your assessment of what happened comparing Sweden to the other Scandinavian countries?
Well, they had 10 times the mortality over the period than Norway and 5 times the mortality of Denmark. So I'd say it didn't work too well. And they weren't protected from the second surge either. They never really got that many people infected. They just, in order to get to herd immunity, you need like 70%, right? And they got up to 7 point something percent in Stockholm, but at the cost of an unbelievable, a very large number of deaths.
And last, in China, there have been reports that there have been transmission as a result of pork that's been imported from Brazil. And some people have been arrested for selling this pork. Is that an issue of concern? The meat and other products, food products, particularly meat, can become contaminated, and can you get a virus from that?
I mean, I didn't hear about this, but it strikes me as highly unlikely. There are all sorts of other stuff you can get from pork, but not respiratory viruses. Somebody'd have to have sneezed on it. And you'd have to go sniff it and inhale it in order to, I mean, it's just too preposterous for words how that might happen. But I think it's pretty, I'd say it was, exceptionally unlikely to the point of being zero.
And last, I mean, the future in this country out of the pandemic, what are the lessons people are probably going to take as a result? We're still going into a very heavy concentration of the virus expansion. What does it mean for the future of the United States and the lessons of this pandemic, which we haven't had one in 100 years like this?
Well, I don't know. We had HIV, right, which is pretty big epidemic, killed a lot of people, but not not for a respiratory virus. And you're absolutely right. I think the primary lesson is to avoid hubris. It's like we're learning the great lessons of Greek tragedy all over again. We knew about this in the 5th century BC, and we seem to have forgotten it. Um, you know, Hubris is a huge problem, right? Hubris led us to CDC saying, oh, we can make enough diagnostic tests for everybody else. We don't need to buy anybody else's. And it turns out to be complete, that was a month down the tubes. Hubris led us to forget the lessons of China. China gave us a 2-month head start on, on getting ourselves ready, and we failed to do it, right? We knew about this on December 31st. And it was, we're still screwing around with it in March. Right? We also, hubris has led us down the path of screwing around with masks, which is completely unnecessary. There's no point in doing that. It's led us into this, which I think we're probably okay in, although it could have gone wrong, of only backing 4 vaccines. Well, there are 11 that have been made around the world, saying, it's only ours that count. I mean, I think there are a lot of lessons to be learned. But I think the primary lesson that I take away is about being cheap and not being prepared. The White House closed its Office of Pandemic Preparedness in this administration. It also defunded the United States Agency for International Development, which had an early warning network for these kinds of viruses, including one that was based in Wuhan, China, that concentrated on bat viruses, that was defunded in October of 2019. Talk about the world's, lamest move. That more than, I think that CDC's initial fumbling of the reagents for the For the tests, I think those are, really unforgivable kinds of things that we absolutely can't have happen again.
And the WHO, leaving the WHO?
No, stupid. I mean, there's nothing more to say than that. That's just game playing nonsense. WHO is not the world's most adroit organization, and it is, at the end of the day, a bureaucracy. But it's gotten, you know, it's difficult to rise to its full potential when everybody keeps pulling their money out of it. It's, death by a thousand cuts. But incredibly sophisticated, exceptionally good scientists at WHO, and we need them.
Okay, well, I want to thank you very much for joining us. We've been talking with Dr. George Rutherford and the head of the Division of Preventive Medicine and Public Health at the University of California in San Francisco. Thanks for joining us on Work Week.
My pleasure.